Hello, welcome to Voices of Hope's Advocacy and Peer Recovery Work webinar. This webinar will give you one CEU in advocacy with the completion of the post-test at the end of the webinar. This webinar is brought to you by Voices of Hope Inc. Voices of Hope Inc. is a 501c3 nonprofit recovery community organization made up of people in recovery, family members, and allies who support recovery throughout Maryland, but primarily in Cecil and Harford counties. Our mission is to advocate for behavioral health disorder prevention, intervention, treatment, and recovery resources, eliminate the stigma of addiction through outreach events and education, and support all pathways of recovery. Voices of Hope's vision is to end the cycle of addiction, heal families affected by addiction, and change the perception of addiction for all. This webinar is being brought to you at no cost, but we would ask that you consider donating to our cause so we can continue to provide resources to our community and the state of Maryland. You can learn more about that at the website listed on the screen. Now let's jump into the meat of the webinar. So advocacy and peer work is essential because it promotes empowerment, reduces stigma, provides support, and works towards systematic change. It can help individuals with similar experiences navigate their challenges, access needed services, and find hope and resilience in their journey toward recovery and well-being. So today we're going to talk about what is advocacy, the different types of advocacy, the role of peer recovery specialists, advocacy in action, advocacy skills, advocacy at different levels, ethical considerations, overcoming challenges in advocacy, and resources and support. Peer work refers to the practice of individuals with similar lived experiences, often related to issues like mental health, addiction, or other challenges, advocating on behalf of or alongside their peers. It involves supporting and representing the needs, rights, and interests of individuals who share these common experiences. The primary goal of advocacy in peer work is to empower and assist peers in accessing appropriate services, resources, and support, while also working to reduce stigma and bring about positive changes in system and policies that affect the well-being of those they serve. This type of advocacy is typically grounded in empathy, shared experiences, and a deep understanding of the challenges faced by the individuals being advocated for. Advocacy plays a crucial role in supporting individuals in recovery from various challenges, including substance abuse, mental health issues, and other life-altering experiences. Here are some key reasons why advocacy is important in this context. Access to resources. Advocates can help individuals in recovery access essential resources such as treatment programs, counseling, housing, and employment support. Navigating the complex web of services and programs can be overwhelming, and advocates can streamline the process. Fighting stigma. Advocacy can challenge and reduce the stigma associated with addiction, mental health, and recovery. This helps individuals feel less judged and more accepted, which can enhance their self-esteem and motivation for recovery. Empowerment. Advocacy empowers individuals by giving them a voice and a sense of control over their recovery journey. This empowerment can increase self-confidence and the motivation to make positive changes in their life. Community and support. Advocates often provide a sense of community and support. They can serve as role models, demonstrating that recovery is possible, and provide emotional support and encouragement during challenging times. Personalized care. Advocates can help ensure that individuals receive care tailored to their specific needs and preferences. This personalization can improve the effectiveness of treatment and recovery efforts. Advocating for rights. Advocacy can help protect the legal and human rights of individuals in recovery. This includes advocating for fair treatment, confidentiality, and equal opportunities in education and employment. Navigating challenges. Recovery can involve numerous obstacles, including legal issues, financial difficulties, and housing instability. Advocates can help individuals navigate these challenges and connect with relevant support services. Continued recovery. Advocates can provide ongoing support and motivation to maintain long-term recovery. This includes assisting individuals in finding relapse prevention strategies, coping with triggers, and building a stable and fulfilling life in recovery. Systematic change. Advocacy can lead to systematic changes in policies and programs related to addiction and mental health services. This can lead to improved access to care, reduced barriers, and better outcomes for all individuals in recovery. Education and awareness. Advocates can educate individuals about the nature of their challenges, treatment options, and the importance of recovery. Increased awareness and understanding can empower individuals to make informed decisions. In summary, advocacy is vital in supporting individuals in recovery because it provides access to resources, reduces stigma, empowers individuals, offers a sense of community and support, and helps address legal and systematic barriers. It plays a crucial role in helping individuals navigate the complex journey of recovery and achieve positive, long-lasting outcomes. There are many different types of advocacy: individual advocacy, systematic advocacy, self-advocacy, and community advocacy. One thing they all have in common is it takes action. Action changes things. Let's talk a little bit about individual advocacy. This is the kind of advocacy as a peer recovery specialist you're probably doing on a daily basis already without even realizing it. Individual advocacy in peer work is a specific form of advocacy where individuals with similar lived experiences, often related to mental health, addiction, or other challenges, advocate on behalf of a single individual. This advocacy focuses on providing tailored support to help a peer navigate the challenges they face and access the resources and services they need for their well-being. Here are some key aspects and principles of individual advocacy in peer work. Personalized support. Individual advocacy is highly personalized, with the advocate working closely with a single individual to understand their unique needs, goals, and challenges. Empowerment. The primary goal of individual advocacy is to empower the individual. Advocates aim to enhance the peer's self-determination, self-advocacy skills, and overall sense of control over their life and recovery journey. Listening and understanding. Effective individual advocacy begins with active listening and a deep understanding of the peer's experiences, concerns, and aspirations. This helps the advocate provide relevant support and guidance. Navigating services. Advocates help their peers navigate the complex system of services, including healthcare, housing, education, employment, and social services. They can assist in finding and accessing appropriate resources. Problem solving. Advocates work with peers to identify challenges and develop strategies for addressing them. This may involve problem solving, setting goals, and creating action plans. Education and information. Advocates provide information and education on the peer's rights, available services, and the nature of their challenges. This knowledge empowers the individual to make informed decisions. Support and motivation. Advocates offer emotional support, encouragement, and motivation. This can be a source of inspiration, especially during difficult times in the recovery journey. This is a good area where sharing your story can help. Advocacy for rights. Advocates can stand up for the rights of the individual, ensuring that they are treated fairly, have access to appropriate care, and are protected from discrimination. Collaboration. Individual advocacy often involves collaborating with other service providers, such as mental health professionals or social workers, to ensure a holistic and comprehensive approach to the individual's well-being. Confidentiality. Advocates must prioritize and maintain the confidentiality and privacy of the individuals they are supporting. Long-term relationship. Individual advocacy may involve ongoing support and a long-term relationship between the advocate and the peer, as recovery is often a gradual and evolving process. In essence, individual advocacy and peer work is a highly person-centered and empowering approach that aims to support individuals in their unique journeys towards recovery and well-being. It is grounded in shared experiences, empathy, and the principle that individuals with similar experiences can be particularly effective in helping their peers navigate the challenges they face. Let's move on now to systematic advocacy, and this is what most people think when they hear the word advocacy. Systematic advocacy in peer work involves advocating for broader changes at the systematic level to improve the well-being, support, and rights of individuals who share common challenges or lived experiences, such as mental health, addiction, or other issues. This form of advocacy focuses on changing policies, practices, and institutions to address structural and systematic issues that can impact the lives of peers. Here are key aspects and principles of systematic advocacy in peer work. Identifying systematic issues. Systematic advocates work to identify systematic issues or barriers that affect peers' access to appropriate services, support, and rights. These issues can range from discriminatory policies to gaps in services. Collective action. Systematic advocacy often involves collective action, as peers come together to advocate for changes that will benefit a larger group of individuals. This can include forming advocacy groups, coalitions, or networks. Policy change. Advocates aim to influence policy changes at various levels, from local to national. This can involve advocating for new laws, regulations, or changes to existing policies. Reducing stigma. Advocates work to reduce the stigma associated with the challenges faced by peers. Changing public perceptions and attitudes is often a crucial part of systematic advocacy. Access to services. The goal of systematic advocacy is to improve the availability and accessibility of services that support recovery, mental health, addiction treatment, and overall well-being. Equity and inclusion. Advocates focus on promoting equity and inclusion in services, ensuring they are accessible to individuals from diverse backgrounds and communities. This is where the saying, nothing about us without us. We have to be involved in that systematic advocacy for it to work for us. And that leads to consumer input. Systematic advocacy often emphasizes the importance of peer involvement in decision-making processes related to service design, evaluation, and policy development. Lobbying and awareness campaigns. Systematic advocates may engage in lobbying efforts, public awareness campaigns, and education to raise awareness of the issues and drive change. Collaboration with stakeholders. Advocates collaborate with various stakeholders, including government agencies, service providers, community organizations, and the public to create systematic change. We all have to work together for it to work. Data collection and research. Advocates may gather and use data and research to support their claims and demonstrate the need for systematic change. If you've ever heard of evidence-based practices, those come about from that data collection and research. Legal advocacy. In some cases, systematic advocacy may involve legal action to change policies or practices that are discriminatory or harmful to peers. Long-term vision. Systematic advocacy often has a long-term vision, seeking to create lasting changes that will benefit not only the current generation of peers, but also future generations. Systematic advocacy in peer work is essential for addressing structural barriers, improving services, and promoting social change that benefits individuals facing common challenges. By working together at a broader level, peers can have a significant impact on the systems that influence their lives, leading to more supportive and inclusive environments for recovery and well-being. The next area of advocacy that I want to talk about is self-advocacy. Self-advocacy is a crucial skill for individuals involved in peer work, as it enables them to effectively communicate their needs, rights, and preferences while navigating the challenges they face, which may include mental health issues, addiction, or other lived experiences. Here are some key principles and strategies for self-advocacy in peer work. Big piece of self-advocacy: know your rights. Understand your legal rights and entitlements. Knowledge of your rights is essential when advocating for yourself or on behalf of others. Self-awareness. Develop self-awareness about your needs, goals, and limitations. Knowing yourself is the first step in effectively advocating for your well-being. Clarify your goals. Clearly define your objectives and what you hope to achieve through self-advocacy. Having a specific goal in mind makes your advocacy efforts more focused. Assertiveness. Practice being assertive in expressing your needs and concerns. It's important to communicate your preferences and boundaries confidently and respectively. But I do want you to note, assertiveness and aggression are very different things. Make sure you're being assertive, not aggressive. Effective communication. Learn how to communicate clearly and effectively. Use active listening and open, non-confrontational dialogue to convey your message. Use your peer experience. Utilize your own lived experience to support your advocacy efforts. Sharing your story and insights can be a powerful tool for connecting with others and making your case. Build a support network. Surround yourself with supportive peers and allies who can provide guidance, encouragement, and if needed, backup during advocacy efforts. You do not have to do this alone. Documentation. Keep records of your interactions and advocacy efforts, including emails, phone calls, or other relevant documents. Documentation can be crucial in resolving disputes or demonstrating your needs. Research and information. Gather relevant information, facts, and data to support your case. Solid evidence can be persuasive when advocating for your rights or the rights of others. Stay persistent. Advocacy may require persistence. Be prepared to follow up and continue your efforts, even in the face of obstacles or setbacks. Confidence and resilience. Believe in yourself and your ability to advocate effectively. Developing resilience can help you bounce back from setbacks. Seek guidance. Don't hesitate to seek advice or assistance from professional advocates, counselors, or legal experts when needed. They can provide valuable guidance and expertise. Self-care. Be sure to prioritize self-care to maintain your well-being. Advocacy can be emotionally taxing, so taking care of your mental and physical health is essential. Know when to compromise. While advocating for your needs, be open to negotiation and compromise when appropriate. Flexibility can help you achieve a solution that benefits all parties. Learn from experience. Reflect on your advocacy efforts, both successful and unsuccessful. Continuously learn and refine your advocacy skills based on your experiences. Self-advocacy is a vital skill for individuals engaged in peer work, as it not only helps them navigate their personal challenges, but also empowers them to advocate effectively for the rights and well-being of their peers, contributing to a more supportive and inclusive environment for all. Let's talk a bit about community advocacy. Community advocacy and peer work involves advocating for the well-being, rights, and needs of individuals who share common challenges, such as mental health issues, addiction, or other lived experiences, within a specific community or locality. It focuses on creating positive changes, raising awareness, and improving support systems for individuals in the community. Here are some key principles and strategies for community advocacy in peer work. Community engagement. Engage with the community to understand its unique needs and challenges. This may involve conducting surveys, attending local meetings, and listening to community members' concerns. Educational initiatives. Develop and implement educational programs or campaigns to raise awareness about the challenges faced by peers and to combat stigma. Provide information on available resources and support services. Coalition partnerships and coalitions with community organizations, stakeholders, and individuals who can support advocacy efforts. Collaboration can amplify the impact of advocacy. Community events. Organize or participate in community events, workshops, and seminars to create a platform for discussions, share experiences, and build a sense of community among peers. Advocacy groups. Establish or join advocacy groups specifically focused on the needs of peers in the community. If you're not familiar, there's quite a few advocacy groups for peers in the state of Maryland already. There is MARCO, the Maryland Association of Recovery Community Organizations. There is MPAC, Maryland Peer Advisory Council, both super strong advocacy groups in this work. Media and public relations. Use media, including social media, local newspapers, and public relations, to disseminate information and success stories that promote peer well-being and recovery. Advocacy. Advocate for changes in local policies, practices, and services that may impact the well-being and rights of peers within the community. Community resources. Work to enhance and expand the availability of community resources, including mental health services, addiction treatment, affordable housing, and employment support. Peer support networks. Establish and promote peer support networks within the community to provide a sense of belonging, reduce isolation, and offer mutual support. This is an area where social media can be a huge benefit. There are quite a few peer support networks on Facebook. Check them out and join a few of them to get the conversation going. Legislative advocacy. Advocate for relevant legislative changes at the local, state, or national levels that can benefit peers within the community. This may include fighting for equal rights and protection against discrimination. Crisis response. Developers support crisis intervention and response systems to ensure that individuals in the community receive timely and appropriate care during emergencies. Community inclusion. Promote community inclusion and involvement for peers in activities, employment, education, and social life. Advocate for the removal of barriers that hinder full participation. This is a big area where Voices of Hope leans in. We have a lot of community activities. We inform our communities, we train the people in our communities, and we have a lot of social activities that happen for people to get involved in. Data collection and analysis. Gather data to support community advocacy efforts, demonstrating the need for changes and evaluating the effectiveness of initiatives. Cultural competency. Ensure that advocacy efforts are culturally competent, respecting and acknowledging the diverse backgrounds and needs of peers within the community. Continuing education. Provide ongoing training and education for community members, professionals, and advocates to keep them informed about the latest developments in peer support and recovery. Community advocacy in peer work plays a pivotal role in creating a more supportive, inclusive, and understanding community that empowers individuals to lead healthier, more fulfilling lives while overcoming the challenges they face. It emphasizes the power of community involvement and collective action in achieving these positive changes. Let's talk a little bit about the unique role that CPRSs play in advocacy. Certified Peer Recovery Specialists, CPRSs, play a unique and critical role in advocacy within the context of mental health and addiction recovery. CPRSs are individuals who have personal experience with mental health challenges and/or addiction and have completed training and certification to provide peer support and assistance to others on their recovery journey. Here are ways in which CPRS can bring a unique perspective and value to advocacy. Lived experience. CPRS share a lived experience with the individuals they support, which can foster trust, empathy, and a deeper connection. This shared experience allows CPRS to speak from a place of authenticity and understanding. Role modeling. CPRSs serve as living examples that recovery is possible. Their personal stories of resilience and recovery can inspire hope and motivation in others who are on their recovery paths. Stigma reduction. CPRSs are often at the forefront of efforts to reduce stigma related to mental health and addiction. They challenge stereotypes and misconceptions by openly sharing their own experience and advocating for more compassionate and informed attitudes. Individualized support. CPRSs provide personalized support based on their own experiences and the needs of the individuals they work with. They can offer practical guidance and solutions that are informed by their journey to recovery. Peer-driven advocacy. CPRSs are uniquely positioned to advocate for the needs and rights of individuals in recovery. They can effectively convey the perspectives and concerns of their peers to policymakers, service providers, and the community. Engagement and trust. CPRSs often excel in engaging individuals who might be hesitant to seek help or support. Their approach is non-judgmental, and they can build a strong rapport with those they serve. Collaboration. CPRSs work collaboratively with mental health professionals, treatment providers, and organizations to ensure that the peer perspective is included in the planning and delivery of these services. Cultural competency. CPRSs who share cultural backgrounds with those they support can provide culturally competent advocacy and support, ensuring that services are sensitive to the specific needs of different communities. Advocacy for recovery-oriented services. CPRSs often advocate for the development and implementation of recovery-oriented services that focus on strengths, hope, and individualized goals rather than solely a clinical approach. If you're not familiar with ROSC, Recovery-Oriented System of Care, I encourage you to research what that is and how it benefits each community that has one. Talked a lot about systematic change. CPRSs can influence systematic change by advocating for policies and practices that better support recovery and mental health. They may participate in policy development, serve on committees, and provide input on the design of services. Supporting peer-run initiatives. CPRSs may play a key role in the development and operation of peer-run organizations and support groups that provide crucial resources and advocacy within the community. In summary, CPRSs bring a unique and invaluable perspective to advocacy efforts. They bridge the gap between personal experience and professional support, contributing to the recovery of others while advocating for a more inclusive, stigma-reducing, and recovery-focused system of care and support. Their role in advocacy helps create a more supportive and understanding environment for individuals in recovery. Advocacy in action in peer work refers to the practical implementation of advocacy efforts to promote the well-being, rights, and interests of individuals who share common challenges or lived experience, such as mental health issues, addiction, or recovery. It involves taking concrete steps to affect change and make a positive impact within the peer community. Here are some examples of advocacy in action in peer work. Awareness campaigns. Organizing and participating in public awareness campaigns to reduce stigma and raise awareness about mental health, addiction, and recovery issues. This can include events, social media campaigns, and community education programs. Are you a member of the Maryland Peer Advisory Council? Are you a member of Maryland Coalition of Families? Policy advocacy. Engaging in advocacy efforts to influence local, state, or national policies related to mental health, addiction treatment, recovery support, and the protection of individuals' rights. This may include lobbying, policy research, and collaboration with lawmakers. This is one of the ways that peers got reimbursed by Medicaid in the state of Maryland, a group effort that included going to Annapolis and advocating for the change. Community engagement. Hosting community forums, support groups, and town hall meetings to engage with the community, listen to concerns, and raise awareness about the challenges faced by peers. This is where you can join the Voices of Hope United Maryland Peers Facebook page, the Maryland Behavioral Health Peer Recovery Specialist page, and PACT, so you can see what the peer community is doing. Oriented program development. Collaborating with organizations to develop and implement recovery-oriented programs and services that emphasize individual strengths and goals. On Our Own, MPACT, Voices of Hope, Marco, all the organizations that collaborate on peer programming in Maryland. Advocating for equal rights. Advocating for the equal treatment and protection of the rights of individuals with mental health and/or addiction challenges, including advocating against discrimination in employment, housing, and healthcare. Systematic change initiatives. Working with organizations or coalitions to effect systematic changes in the delivery of mental health and addiction services, addressing issues such as accessibility, quality, and cultural competencies. Peer-run initiatives. Establishing and running peer-run organizations, support groups, and crisis helplines that provide essential resources and support to peers within the community. Educational workshops. Conducting workshops, training sessions, like the one you're watching right now, and informational seminars to educate peers, families, professionals, and the public about mental health addiction and recovery issues. Collaboration with stakeholders. Collaborating with various stakeholders, such as mental health professionals, service providers, community organizations, and government agencies to foster a holistic approach to peer support and advocacy. Legislative testimony. Providing testimonies and sharing personal experiences before legislative bodies, such as city councils or state legislators, to influence the development of policies and funding for mental health and addiction services. I know legislative testimony can be a terrifying thought, speaking in front of all of those people, but the only way that we're going to make changes in the peer world is for peers to speak up and share their lived experience with those that make the decisions. Data collection and research. Gathering that data and conducting research to support advocacy efforts and demonstrate the need for changes in policies, services, and community support. Crisis response and intervention. Responding to crises and emergencies within the peer community to ensure that individuals receive the appropriate care and support. Empowerment initiatives. Developing programs that empower peers to become self-advocates and advocates for others, equipping them with the skills and knowledge to effect positive change. Advocacy in action in peer work is about taking tangible steps to create positive changes, support recovery, and promote a more inclusive, empathetic, and recovery-oriented community and system of care. These actions help peers, their families, and the broader community better understand and address the challenges related to mental health, addiction, and recovery. Advocacy skills. We've talked a lot about how advocacy works, but advocacy skills are essential in peer work as they enable individuals with shared experiences, such as mental health challenges, addiction, or recovery, to effectively advocate for themselves and others. Here are some key advocacy skills and competencies that are important in peer work. Active listening. Effective advocacy begins with active listening. This skill allows advocates to fully understand the concerns, needs, and perspectives of the individuals they are supporting. Communication. Clear and effective communication is vital. Advocates should be able to express themselves well, whether in one-on-one conversations, group settings, or written communication. Empathy. Empathy involves understanding and sharing the feelings and experiences of others. It helps advocates connect with individuals and show genuine care and support. Assertiveness. Being assertive is necessary when advocating for the rights and needs of individuals. Advocates need to express themselves confidently while respecting the rights and perspective of others. Conflict resolution. Advocates should be skilled in resolving conflicts and disputes, as advocacy efforts may encounter resistance or opposition. Conflict resolution helps maintain positive relationships and move forward effectively. Problem solving. Problem-solving skills are essential for identifying challenges and developing solutions. Advocates need to help individuals navigate complex issues and find ways to address them. Research. Research skills are valuable for gathering information, data, and evidence to support advocacy efforts, whether it involves policy research or gathering information about available resources. Networking. Building and maintaining a network of contacts and relationships with other advocates, service providers, organizations, and stakeholders is crucial for effective advocacy. Cultural competency. Advocacy and peer work often involves working with individuals from diverse cultural backgrounds. Cultural competency is necessary to ensure that advocacy efforts are sensitive to cultural differences and needs. Public speaking. The fear of most people in the world. Public speaking skills can be important for advocating in public forums, meetings, or presentations. Effective public speaking helps advocates convey their message with confidence and clarity. Collaboration. Advocacy often requires collaboration with other advocates and organizations. The ability to work as part of a team, share responsibilities, and coordinate efforts is a valuable skill. Documentation. Advocates should be able to maintain records and documentation of their advocacy efforts, including important information, correspondence, and progress reports. Understanding of rights and policies. A solid understanding of the rights and policies that affect individuals in recovery is essential. Advocates need to know the laws and regulations that govern their areas of advocacy. Resource navigation. Advocates should be knowledgeable about the available resources, services, and support systems within their community or area of focus. They need to help individuals access these resources. Adaptability. Advocacy often involves dealing with dynamic situations and changing circumstances. Advocates need to be adaptable and flexible in their approach. Resilience. Advocacy work can be challenging and emotionally taxing. Resilience is important for maintaining motivation, overcoming setbacks, and continuing to advocate effectively. Advocacy planning. The ability to create well-structured advocacy plans that outline goals, strategies, and timelines is important for ensuring that advocacy efforts are organized and targeted. Self-care. Advocates must prioritize self-care to maintain their own well-being. This involves recognizing the emotional toll advocacy can take and taking steps to manage stress and maintain a healthy work-life balance. I'd like to point out that all those advocacy skills that we just talked about are skills you already have. They're skills you're using on a daily basis in peer work. There's nothing additional you need to do to make those advocacy skills as well, except use them. Developing these advocacy skills is important for individuals engaged in peer work to effectively support and empower their peers, advocate for needed changes, and create more supportive and inclusive environments for recovery and well-being. Let's talk a little bit more about advocacy at different levels. Advocacy in peer work can occur at various levels, each with its own focus and strategies. Here are different levels of advocacy in peer work. As we discussed in length before, individual advocacy. At the individual level, peer advocates work directly with one person to help them access services, navigate challenges, and assert their rights. This may involve advocating for a specific individual's needs, such as helping them find housing, employment, or treatment options. Interpersonal advocacy. At this level, peer advocates work with a small group of individuals or families, providing peer support, education, and advocacy for their collective needs. It may involve facilitating peer support groups or family support networks. Community advocacy. Community-level advocacy focuses on raising awareness, reducing stigma, and creating a more supportive community environment for peers. This can involve organizing community events, educational workshops, or awareness campaigns. Organizational advocacy. Peer advocates at this level may work within organizations that provide mental health or addiction services. They advocate for changes within these organizations to make them more recovery-oriented, person-centered, and culturally competent. Systems advocacy. Systematic advocacy involves advocating for changes in policies, regulations, and practices within larger systems, such as healthcare, education, or criminal justice. It may include lobbying for policy changes at local, state, or national levels. Legislative advocacy. Legislative advocacy is about influencing lawmakers and government bodies to develop and pass laws that protect the rights and well-being of peers. It can involve testifying before legislative committees, meeting with elected officials, and advocating for funding for mental health and addiction services. Policy advocacy. This level of advocacy focuses on shaping policies that impact peers at the local, state, and national level. It includes researching and analyzing policies, providing input on policy development, and advocating for changes to policies that affect peers. Public advocacy. Public advocacy involves advocating in public forums, engaging with the media, and using social media to raise awareness about issues affecting peers and to mobilize public support for advocacy goals. Collaborative advocacy. Peer advocates may work collaboratively with other advocacy organizations, service providers, professionals, and stakeholders to address common goals and advocate for broader systematic changes. Research and data advocacy. Advocates may collect and use data to support their advocacy efforts, demonstrate the need for changes, and evaluating effectiveness of programs and services. Crisis advocacy. In times of crisis, such as natural disasters or public health emergencies, we all learned about those during COVID, peer advocates may engage in crisis advocacy to ensure that individuals in recovery receive appropriate care and support. Global advocacy. In some cases, peer advocates may engage in advocacy efforts at the international level, participating in global conversations about mental health, addiction, and human rights. Legal advocacy. Peer advocates can engage in legal advocacy to protect the rights of peers, challenge discriminatory practices, and ensure that peers have access to justice. Advocacy at different levels in peer work is interconnected and can be part of a comprehensive strategy to create more supportive, inclusive, and recovery-oriented environments for individuals facing mental health and addiction challenges. The choice of level and approach depends on the specific goals and priorities of the advocacy effort. Let's all take a moment and breathe. Advocacy is not a race to the finish. It is a process to affect change. You'll see on the screen that there is a race car. Race car is the secret word. But now I just want to take a moment. We have gone over advocacy in many different forms, and some of it has been repetitive. But this is how advocacy works. It's continuing, it's being persistent, it is putting the effort in to make the changes that can affect so many people that already don't have the ability to make those changes themselves. I encourage each of you to take a moment and think about the things that we talked about on this webinar today. How can you take one or two of those and make an advocacy effort today? All right, let's get into the rest of the webinar. As all things in peer work, ethical considerations guide our decision-making process in everything when it comes to being a peer, and that doesn't change for advocacy. Advocacy in peer work, like any form of advocacy, is bound by ethical considerations and principles to ensure that the advocacy efforts are conducted in a responsible and respectful manner. Here are some key ethical considerations in peer work advocacy. Respect for autonomy. Advocates must respect the autonomy and choices of individuals they are advocating for. It's important to support their self-determination and right to make decisions about their own lives, even if those decisions differ from the advocate's recommendations. Confidentiality. Advocates should maintain the confidentiality and privacy of the individuals they work with, being cautious about sharing personal information and experiences without clear consent. That leads into informed consent. Before engaging in advocacy on behalf of another person, advocates should seek informed consent. Individuals should be fully aware of the advocacy goals, strategies, and potential consequences. Conflicts of interest. Advocates must be transparent about any potential conflicts of interest. This includes disclosing personal, financial, or professional interests that could affect the advocacy process. Cultural sensitivity. Advocates must be culturally sensitive and aware of the diversity of the individuals they work with. Respect for cultural differences and preferences is essential in advocacy efforts. Non-discrimination. Advocates should work against discrimination and bias, striving to promote equity and inclusion. They must not discriminate against individuals based on race, gender, sexual orientation, religion, disability, or other characteristics. Professional boundaries. Advocates should maintain professional boundaries with the individuals they serve. While personal connections and shared experiences can be valuable, they should not be exploited, and the advocate's primary role remains focused on advocacy. Transparency and honesty. Advocates should be transparent about their qualifications, roles, and limitations. They should provide honest information to individuals they serve, avoiding misleading or false statements. I struggle with this word, guys. Beneficence. Advocates should prioritize the well-being and best interests of the individuals they work with. Their advocacy efforts should aim to improve the quality of life and access to services for those they are advocating for. Accountability. Advocates must be accountable for their actions and decisions. They should accept responsibility for the consequences of their advocacy efforts and be open to feedback and evaluation. Collaboration. Advocates should collaborate with other professionals, organizations, and stakeholders to ensure a comprehensive and coordinated approach to advocacy efforts. Self-care, we brought this up a couple times. Advocates must prioritize self-care to maintain their own well-being and resilience. Advocacy work can be emotionally taxing, so managing stress and maintaining a work-life balance is important. Supervision and training. Continuous training, supervision, and support are important for advocates to ensure that they have the necessary knowledge and skills to carry out their advocacy roles effectively and ethically. Legal and ethical guidelines. Advocates should be familiar with and adhere to relevant laws, regulations, and ethical guidelines that pertain to their advocacy work. particularly when advocating for the rights and protections of individuals. When you go to apply to take the CPRS exam in the state of Maryland, you have to agree to the ethical guidelines as they are put out by the MAB PCB, and those should be the guidelines that help you get through this work ethically. Ethical considerations are foundational to maintaining the integrity and effectiveness of advocacy in peer work. These principles help ensure that advocacy efforts are conducted with respect, fairness, and a commitment to the well-being and rights of the individuals being advocated for. As with peer work in general, advocacy in peer work can be challenging, but there are ways to overcome these challenges and make advocacy efforts more effective. Here's some strategies for addressing common challenges in peer work advocacy. Stigma and discrimination. Challenge stigma and discrimination by providing education and personal stories that humanize the issue. Encourage open dialogue and awareness campaigns to change public perceptions. Lack of resources. Address resource limitations by collaborating with other organizations and seeking creative solutions. Leverage existing resources, build partnerships, and apply for grants or funding to support advocacy efforts. Institutional barriers. When advocating for changes within institutions or systems, build relationships with decision makers and stakeholders. Present evidence-based arguments and propose solutions that are aligned with the institution's goal. Proposing those solutions are key to letting people know that you are focused on the solution and not on the problem. A huge challenge in advocacy efforts can be burnout. Advocacy can be emotionally taxing. Encourage self-care practices among advocates and provide emotional support to prevent burnout. Rotate advocacy responsibilities to share the workload. This is not work you can do alone. It has to be done in a group, and everybody has to pull their weight for it to work and for people to not get burned out. Limited access to information. Research and gather data to support your advocacy efforts. If information is not readily available, work with experts or researchers to collect relevant data that strengthens your case. Inadequate training. Ensure advocates are adequately trained and continuously updated on advocacy techniques, ethics, and best practices. The peer work is an ever-changing field, and advocates need to keep up on those changes so they can advocate effectively. Provide opportunities for skill building and learning from experienced advocacy. There's nothing better in advocacy than having a mentor show you the ropes. Lack of unity. Peer advocates may have varying perspectives and approaches. Promote unity by focusing on common goals and shared values, while respecting the diversity in experiences and opinions. We all come from different backgrounds. Don't let that be a barrier to unity in creating peer work that helps everyone from all cultures. Resistance from systems. In the face of resistance from systems or policies, maintain persistence, continue to advocate, gather support from the community, and collaborate with other advocacy organizations to increase the pressure on decision makers. Lack of public awareness. Address this challenge by conducting public awareness campaigns, sharing personal stories, leveraging media and social platforms to reach a broader audience. Humanizing the face of people in this field is what enables us to speak to more people on a daily basis. Time constraints. I think we all know that there are not enough hours in the day for this work. Advocate for a reasonable time frame for changes and set achievable milestones. Recognize that change often takes time and be patient while advocating for improvements. Advocacy fatigue. Advocacy efforts can be prolonged and advocates may experience fatigue. Rotate advocates, encourage breaks, and provide opportunities for peer support to help manage that fatigue. Lack of support. Seek support from peer-run organizations, advocacy groups, and allies who share a common goal. Collaborative efforts can strengthen advocacy and provide a sense of belonging, something we all need in this world. Fear of disclosure. If peers fear disclosing their experiences, create safe and confidential spaces where individuals can share their stories without judgment or repercussions. Understanding the legal landscape. Develop a deep understanding of the legal landscape, including relevant laws and regulations. Seek legal guidance when necessary to navigate complex legal issues. Balancing personal experience and advocacy. It can be challenging for advocates to balance their own recovery with advocacy work. Encourage advocates to prioritize their own well-being, set boundaries, and seek support when needed. One of the biggest pitfalls of peer work is I work in recovery all day, I'm in the field all day, that's enough recovery for a day, that's all I need. Each one of us needs our own recovery pathway to make sure that we have filled what we need so that we can then come to work and do this work on a daily basis. Overcoming challenges in advocacy. Advocacy and peer work often involves tenacity, creativity, and collaboration. Addressing challenges may require a combination of strategies and approaches, and it's essential to maintain a long-term vision of positive changes for individuals facing mental health and addiction challenges. So we have reviewed a lot of advocacy skills and concepts so far today, but there are some key messages that I would like you to take away from this webinar. Empowerment and self-determination. Advocacy and peer work is a catalyst for empowerment, enabling individuals to take control of their own lives and make informed decisions. Voice and visibility. Every person has a unique story, and advocacy and peer work amplifies these voices, making them heard and fostering a sense of visibility within the community. Breaking stigma. Advocacy challenges stereotypes and breaks down stigma, fostering a more inclusive environment where individuals are seen for their strengths rather than their challenges. Collaboration and solidarity. In peer work advocacy, collaboration is key. Together, we can create a supportive network, standing in solidarity to address common issues and bring about positive change. Rights and dignity. Advocacy and peer work upholds the fundamental rights and dignity of every individual, ensuring they are treated with respect and equality. Education and awareness. Advocacy serves as a tool for education and awareness, promoting understanding and empathy within the community about the experiences and challenges faced by individuals. We talked a lot about policy and system change. Effective advocacy and peer work goes beyond individual support. It seeks to influence policies and systems, creating a more compassionate and responsive environment for all. We talked about cultural competency. Advocacy and peer work recognizes and respects diverse cultural backgrounds, fostering cultural competence and ensuring that support is tailored to individual needs. Hope and resilience. Through advocacy, we inspire hope and resilience, showing that positive change is possible and that individuals can overcome challenges with the right support. Experience as expertise. In peer work advocacy, lived experience is valued as a unique form of expertise, shaping solutions and strategies that truly resonate with individuals facing similar challenges. And lastly, advocacy is a journey. We talked about this earlier. Advocacy is not a destination, it's a journey. In peer work, we walk alongside individuals, supporting them on their path to recovery, growth, and more community integration. These messages highlight the transformative power of advocacy and peer work and emphasize the importance of collaboration, respect, and understanding in fostering positive change. Bringing empathy to advocacy is a powerful approach that not only strengthens the connection between advocates and those they support, but also enhances the effectiveness of advocacy efforts. Understanding through empathy. Empathy is the cornerstone of effective advocacy, as it allows us to truly understand and resonate with the experiences, emotions, and challenges of those we support. Walking in someone else's shoes. Advocating with empathy means stepping into someone else's shoes, seeing the world through their eyes, and embracing a shared humanity that transcends differences. Listening with an open heart. Empathetic advocacy begins with active and open-hearted listening, creating a safe space for individuals to express themselves without judgment. Validation and recognition. Empathy in advocacy involves validating the feelings and experiences of others, recognizing their strengths and affirming their worth as individuals. Cultivating connections. Advocacy is not just about issues, it's about building connections. Empathy forms the bridge that connects advocates with the lived experience of those that they champion. Respectful engagement. Empathetic advocacy is marked by respectful engagement, where individuals are treated with dignity, their opinions are valued, and their autonomy is upheld. Trust is the foundation of effective advocacy, and empathy is the tool that builds it. By showing understanding and compassion, advocates create a trustworthy relationship with those they serve. Empathy fuels our passion for positive change. It's not just about sympathy. It's about channeling shared emotions into actions that drive meaningful transformation. Empathetic advocacy extends beyond the cause itself. It's about caring for the well-being of individuals and recognizing the interconnectedness of their lives. Empathy requires a willingness to embrace vulnerability, acknowledging that each person's journey is unique and that we too are continuously learning and growing. Seeing strength in struggle, it recognizes the resilience and courage of individuals facing challenges and seeks to amplify their voices. And we always want to be promoting inclusivity. Empathy fosters an inclusive advocacy approach where the diverse experiences and perspective of individuals are not only acknowledged, but celebrated. By integrating empathy into advocacy, we not only address issues, but also nurture a compassionate and supportive environment where individuals feel seen, heard, and understood. This in turn enhances the impact and sustainability of advocacy efforts. In conclusion, this webinar on advocacy and peer work has provided valuable insights and information about the critical role of advocacy in supporting individuals who face mental health challenges, addiction, and recovery journeys. We've explored various aspects of advocacy, including its importance, ethical considerations, and the unique role of certified peer recovery specialists in advocacy efforts. Advocacy and peer work is ultimately about empowering individuals to take control of their lives, access the support and services they need, and assert their rights. It's a dynamic and essential aspect of peer support, and when done effectively, it can contribute to a more inclusive, understanding, and recovery-oriented society. I want to thank you for attending this webinar and spending this hour with us. In the comment section, there should be a link for the post-test that will need to be completed for you to get your certificate. If you have any questions, please don't hesitate to reach out to us. Our number and our website are both on the screen now. We wish you much luck in your Certified Peer Recovery Specialist journey, and we are happy to have spent this time with you. Thank you.